this is Mercy and still in Utmost Care and Therapy Services Limited. Care for the elderly. We are passionate about how you care for your elderly. Do you have a senior you are living with and you're wondering the best setting of care for the elderly? I'm going to present to you the two settings that are utmost important: the home-based setting and the live-in setting. With the home-based setting, you bring in the professional, the caregiver or the nurses to care for your senior in your house or in their house. And then the live-in care is where the facility, they are being taken care of. Then you take your senior to the facility to be catered for. So in a condition where you are faced with these two options and you're wondering, what can I do, or which of these options should I go for? There are factors that should help you to take these decisions. One of those factors is the availability of fund. In thinking about caring, the best setting for care for your elder, you have to consider, how much do I have? How much can I pay for this service? Do you have the funding for the home-based care? How many hours of home-based care are you looking out for? Do you have the funding for the live-in care? Because the live-in care certainly is when the person is going to be living there. So there are charges for feeding, the charges for everything, that medical attention, everything that you can think of for the total care of the senior in the live-in care. The second factor is the health condition of the senior. Do the senior have complicated health issues? Are we looking at seizures? Are we looking at high blood pressure, diabetes? Are there internal organ dysfunctions and all that? Does the senior need medical attention at all times? So this is another factor that will help you. And this is where the live-in care has an advantage over the home-based care, because with the live-in care, if it's a senior who has more medical conditions that needs attention, in terms of emergency, the medical personnel are there to give that as the emergency occurs. But in terms of the home-based intervention, you have maybe a nurse who just comes in, and then if there's an emergency, you might need to rush the person down to the hospital. And then the last factor we'll be considering is the connection, the bonding between the senior and the children. For a senior who is already used to the children being around, or being around the children, you might also consider the emotional detachment, the psychological detachment, if the senior is being taken to the home, the live-in care. So all these factors put together will help you to take a better decision on which of the settings will best suit your senior for the best care. So next week we'll be bringing in another topic on care for the seniors. So I would like you to like, share, and subscribe so that you'll get the notification when the video drops. Thank you.